And immunotherapy is actually used up front for the treatment of metastatic liver cancer, HCC. And so this patient was started on atezolizumab and bevacizumab. She didn't respond at all. She started on a second generation tyrosine kinase inhibitor that targets VEGF. We tried lenvatinib. That didn't work. And by that time, she had this mass that was in her abdomen that literally you could feel. And with each subsequent therapy, the immunotherapy, the targeted therapy, even the other phase 1 clinical trial, we saw continued growth of this tumor. It was causing a ton of pain. So she reported kind of continuous 7 out of 10 pain. That's really unacceptable. And we also knew that, I mean, if this thing is going to continue to grow, eventually it's going to block the bowel or, I mean, even potentially protrude out of the skin. And so usually in that case, as oncologists, we're going to recommend hospice because we expect in the next couple of months that maybe, there would be a really, really unfortunate or bad outcome. And I think my patient kind of understood that as well. But she was eligible for BOT+BAL. We put her on the phase 1. And really, I mean, this is the last Hail Mary attempt. We knew, if this didn't work, we were absolutely going to send this patient to hospice, where the life expectancy really would be measured in months. And just after a couple of doses, you could actually feel this thing in her abdomen. Her pain went from a 7 out of 10. After like literally 4 weeks, it went to a 0 out of 10. It was unbelievable. Her AFP, alpha fetoprotein, which is a tumor marker that we measure in the blood, it was literally 200,000, right? Normal, you don't want that thing to be above, single digits, right? And that had completely normalized after 2 months. One of the most dramatic responses I've ever seen in my entire life. And the thing that was so gratifying about it is that the patient her pain was gone, right? When you look at the imaging, all that was left was like this shell, right? Kind of what I assume is just fibrotic or scar tissue. The amazing thing about this patient is that she was going to hospice 2 years later after being on the BOT+BAL study. She came off study because that's protocol. And she hasn't required treatment for her cancer now in over 2 years. And this really kind of shows you, number one, exactly what we're talking about, response. Patients feel better. Number two, the durability of response. And for all intents and purposes, with a normal AFP, a normal scan, no treatment in 1.5 to 2 years, I mean, we're effectively talking about cure of a disease that would have probably given her only a couple more months to live. Really just one of those things that you'll never forget as a physician, just an honor to be part of it, a life saved and literally a life cured. And there's stories like this across all investigators that have had experience with BOT+BAL.
Wow. Now, that is a wow. It is nothing short of a miracle to see something like that. And yet, when you talk to individual patient case studies with regulators and regulatory experts, the typical response is that it's an anecdotal case. With traditional treatments, like chemotherapy, not only often do you require continuous therapy for the patient in order for the response to persist, but you also have to deal with the toxicities associated with traditional treatments. More is, sometimes resulting in more responses, but more is also resulting in a lot more toxicity.
When you think about chemotherapy side effects, especially if you say like, okay, well, chemotherapy is going to decrease white blood cells. You imagine when you stop chemotherapy that there'll be, at least somewhat of a recovery, right, of those counts, because you're taking that kind of poisonous toxicity off the table. One of the things with immunotherapy is that when you activate somebody's immune system, you obviously hope it attacks the tumor, and by golly, it really did, right, in this patient. But you also have immune activation in other areas as well that can cause side effects. For this patient, she actually developed adrenal insufficiency, right? And that is a known side effect of immunotherapy. So that requires her to take a daily small amount of steroid. And she'll tell you, right, time over time that she would trade that a million times over for the cure that she's received. But the toxicity, balancing that toxicity and the efficacy of the drug is something that we all do, as investigators, as physicians, And here, I would say the trade-off is, pretty clear, right? You're cured. You do have to take this medicine, but it's kind of one of those things where, is it worth it? For her, she would tell you that she's just living her best life, right?